What was your most memorable experience while you were president of the ASDS?
I think my most memorable experience was overseeing the annual meeting, which we had in Hawaii. So it was a beautiful setting. And I was able to get one of my patients, Senator Lloyd Benson, to give the opening address. He had had a problem with skin cancer, and we took care of it. And he had been a multi-time senator from Texas. He had been Michael Dukakis's running mate as vice presidential candidate, and he was serving as Secretary of the Treasury under Bill Clinton at the time. And so he was able to come on and talk about the importance of healthcare and where he thought healthcare reform was going, which was a huge topic at that time, still is, of course, and really gave a shout out to the importance of dermatologic surgery from a personal experience. So that was a great sort of capstone for the year for me.
What were the most pressing issues at that time that faced the society?
The issues facing the society back in 1990 when I was president, number one was an issue that was sort of an ongoing one, and that was the competition both out in the open and under the table between the plastic surgery establishment and the growing subspecialty of derm surgery. That was a real problem for us. There was conflict about what our scope of practice should be and who should be allowed to do various things in hospitals and ambulatory surgery centers. So that was a major conflict issue during the time. The other big issue facing us as derm surgeons, which we were really struggling with, was the HIV and AIDS epidemic, which was really just getting going and getting well known in medicine at that time. And of course, doing surgery, it became an issue of what precautions every derm surgeon should and had to take at the time versus their normal practice in their office surgery, which wasn't controlled usually by a hospital board or anything. So the AIDS epidemic was really starting to sort of change the way we did things, even in office practice.
What were the most significant innovations that were going on within the dermatologic surgery?
The most significant innovations going on around that time, and it's always hard to put a specific year on it, but in that era, shall we say, was the growth of laser surgery and non-laser light technologies. They were being developed very rapidly, one after the other. And it was the derm surgeons who kind of pioneered this to a great extent and adapted these technologies and worked with the companies to bring these forward. And it really gave us a whole new surgical armamentarium. The other big development was the use of filler agents for cosmetic procedures. We had injectable collagen for a while at that time, but we were suddenly getting a whole slew of new agents, hyaluronic-based agents and so forth from multiple companies. And it was the ASDS at its meetings and workshops that really got these things out to a number of physicians who were sort of thought leaders. And then this became routine practice over the next several years. So those were the big innovations, I think.
And in your career, do you have a most memorable patient that you can think of?
My most memorable patient, or patients, I should say, and I guess I can talk about them because they're deceased now, so we're not violating any confidence, was Senator John Glenn and his wife Annie Glenn. They were Ohioans, and of course John Glenn was a real American hero. He had been the first man to orbit the Earth. He was a war hero, a fighter pilot, a test pilot. He was a multi-term senator from Ohio, and he ended up going back into space later on as the oldest man ever going to space. So this was a nonstop kind of guy. His wife uh, not everybody knows, and they were married for an inordinately long time, and they were both always came together to the office. She had had a speech defect from the time she was a young child, and really became a spokesperson for this. She learned late in life how to communicate, and she went out and formed organizations and led the whole, really a change in the way the US and other countries looked at people with speech difficulties and deficits. And so the two of them were just about the most accomplished, interesting people I ever had a chance to work with.
If you look back on your career, would there be anything that you would change?
And the question of whether you go back and do something differently in your career is always a tough one. All I can say is this year, it's 52 years that I've been a physician, and after training, so I practiced, about 40 some years as a dermatologist and derm surgeon in an academic setting. I still practice. I retired officially about 6 years ago, but I still practice at the Cleveland Clinic 2 days a week, seeing melanoma patients. So I still love it. I really wouldn't change much of anything. I love the academic practice of medicine, the idea of doing clinical patient care, as well as doing clinical research. And the biggest thing is the opportunity to teach new doctors, new dermatologists, residents, fellows. I've had 46 fellows in my career in Mohs surgery, and teaching them has been an honor and a treat.
And what advice would you give today's young dermatologic surgeons?
In talking to the younger dermatologic surgeons finishing training and coming out of practice today, I would say one of the most important things is to find a mentor or mentors. I think that the relationship between a mentor and a mentee is something unique. It has been to me over the years. I've had three terrific mentors in the specialty. One was my chairman and teacher, Henry Rennick, at the Cleveland Clinic. One was Dr. Fred Mohs, who I trained with in Madison, Wisconsin. And one was Dr. Perry Robbins, who I never had as a teacher or professor or instructor, but Perry and I through the years have communicated, and he's been a great mentor and sounding board in terms of career development and dermatologic politics and worldwide derm surgery issues. So I think that if a young derm surgeon can find someone that they're compatible with, that has experience, that has their interest at heart, and really use that relationship, and I use the word use in a good way, that's a critical thing in their career development. You can do it without that, but I think having a mentor or mentors is just a wonderful thing as your career goes forward.
Do you have any predictions for the future of the ASDS?
I think that the future of the subspecialty of dermatologic surgery, the future is very bright. Obviously, medicine is continually under scrutiny in terms of regulation and payment schemes and whatever. But the fact that we deliver services for the most part in an office setting conveniently without a lot of overlay of administrative rules like you'd find in a hospital setting and major ORs, it really gives us an edge in dealing with our patients. It can be quicker, it can be more convenient, it can be more pleasant for the patient. And in terms of reimbursement, it's been shown that doing surgery in the office is safe and is far less costly to whoever's paying for it. So I think we're positioned very, very well in terms of the future. And our kind of practice should really be the type of thing that whoever is responsible for paying for healthcare, we have the type of system that I think they would favor. So I think we're in very good shape going forward.
So what advice do you have for the ASDS leadership in serving its membership in the future?
I think that the advice that I would give the ASDS leadership for the future in dealing with its membership is remember to listen and communicate. What I've found, I've been fortunate enough to be president and a board member of a lot of different dermatologic organizations over the years. What I find is that sometimes as you get into these roles, first you're on the board, first you're on committees, then you're on the board, then you're an officer, and finally you become president perhaps. There's a lot of internal group think. You start talking to the same group of people, a small group, over and over a period of years, and you suddenly forget that all the people you represent may have very divergent views on an issue. So while there may not be a right or a wrong answer, and as leaders, you have to finally decide on some answer, the biggest thing is to involve as many people as possible in the decision making. If you do that, it's much more likely that whatever path you take will be accepted and positively supported by the membership. So I think the biggest thing is never forget to listen to your constituents.